I am Dr. Shayla Toombs Withers, family physician at Essence of Health Wellness Clinic. Thank you for joining me today. So, the majority of people have had their blood pressure checked at least once in their lifetime, and often many times. However, I found that most people don't actually know what the numbers mean or how those numbers actually relate to your health. The month of May has been designated as High Blood Pressure Education Month. So today's discussion will be all about high blood pressure. I will dive into what is high blood pressure, what do the numbers mean, what is the best and proper way to check your blood pressure, and how to prevent and or improve your blood pressure. So let's get started. So first, what is high blood pressure? So blood pressure is actually the pressure of blood pushing against the walls of your arteries. Arteries are blood vessels that carry blood away from your heart and help to supply blood to the other parts of your body. High blood pressure is when the pressure of blood pushing against those artery walls is too high, which can then cause damage to those blood vessels. So, what do the numbers mean? Well, blood pressure is measured using two numbers. That top number is called the systolic blood pressure. This number measures the pressure in your arteries when your heart beats or contracts, that pumping number. The bottom number is called the diastolic blood pressure. This number measures the pressure in your arteries when your heart rests or relaxes, which is between those beats as your heart pumps and relaxes, pumps and relaxes. So, a normal blood pressure is defined as having a blood pressure number that is less than 120/80. Elevated blood pressure is defined as having blood pressure numbers that are consistently ranging from 120 to 129 for the systolic or that top number, and less than 80 for the diastolic or that bottom number blood pressure. Then we have high blood pressure, or also called hypertension, as you may have heard it, is to have blood pressure numbers that are consistently above 130 for the systolic blood pressure or above 80 for the diastolic blood pressure. Numbers at or above these levels have been shown to increase a person's risk of heart disease, stroke, chronic kidney disease, as well as eye problems. So, what is the best and the proper way to check your blood pressure? It is important to measure your blood pressure periodically. The United States Preventive Services Task Force recommends that individuals age 40 or older have their blood pressure checked at least once a year. For those under the age of 40, but who may be at increased risk of developing high blood pressure or complications from high blood pressure, and those individuals would include anyone who has a history of an elevated blood pressure, African American ethnicity, being overweight or obese. Those individuals, even if under 40, should also always have at least a yearly check of their blood pressure. For those adults who are age 18 to 39 with a normal blood pressure history and none of the other risk factors that I just mentioned, then it is recommended that you have your blood pressure checked every 3 to 5 years. And then for kids, the American Academy of Pediatrics recommends that children have yearly blood pressure screenings starting at the age of 3. So if you have children, then you may have seen this being done as part of their well child examination when the vital signs were taken. Now, so if you're checking your blood pressure at home with the home monitor, here are some tips to make sure that you get a proper and an accurate reading. So the first tip is really to preference having an arm blood pressure cuff over a wrist cuff. I actually have one here that I like to use. It's called the Omron. It's a good home blood pressure cuff because the cuff is it's an arm cuff. So it helps you to get a more accurate reading. And I also like this cuff because As you can see, it has good pictures on it. So it's easy, it's very user friendly to show you where exactly to place the cuff on your arm. Um, and then the screen for it is a nice big screen and helps you to understand what those numbers are from the reading that you get. Now, before you take your blood pressure at home, you want to empty your bladder first. You don't want to have a full bladder or anything that may be stressing you out. You want to avoid food, drinks, especially caffeine, for 30 minutes prior to checking your blood pressure. You also want to avoid checking your blood pressure within 30 minutes of exercise or smoking. So don't immediately hop off your treadmill and go check your blood pressure because it may be high. You also want to sit quietly in a chair that has good back support so that you aren't having to support your body. You want your body to be well supported. And you want to place your feet flat on the floor. Make sure that the arm that you are using to check your blood pressure is bare. You don't want to have clothing covering your arm. You want it to be a bare arm between the cuff and your actual arm. And then you want to sit quietly in that comfortable chair for about 5 minutes before actually checking the reading. Then while taking your blood pressure, do not talk. Don't talk to your children, don't talk to other family members, don't have someone on the phone that you're chatting with because that will affect the accuracy of the blood pressure reading that you get. Keep your arm rested on a hard level surface at the height of your chest for the duration of obtaining the blood pressure reading. So preferably you have a chair that may sit a little bit lower to the ground, or if you have an office chair, one that can be adjustable so that you can raise your arm to the height level of your chest because you want it to be a little bit higher because as we know, what we're measuring is that blood that's going away from the heart through those arteries, and so you don't want to have that arm drop because you may not get as accurate of a reading. Then after you check your blood pressure, and I cannot express this enough, please record the reading. Don't just check it and say, oh, that looks good. And then when you go see your doctor, you are guesstimating as to what the numbers actually were. So please don't forget this last step after you check your blood pressure at home is to actually record the reading. Some blood pressure monitors come with a nice little log, but you don't have to have anything fancy. You can write these numbers down in a notebook, or you can track them on your phone. Most people nowadays have a smartphone, and there are even some nice apps that are helpful just for blood pressure tracking. So just record the readings because as your physician, we actually do like to know what those exact numbers are and not just a guesstimate or a range as to what your numbers have been running. And then if you do need to repeat your blood pressure, and that could be for a number of reasons. Maybe it was initially high and you feel like you weren't relaxed enough, so you want to repeat it, or you want to check the other arm to see what the blood pressure looks like in the other arm. Wait at least about 2 minutes to give your blood vessels time to recover and to give your body time to rest again before rechecking your blood pressure. And then be sure to follow those same set of steps during checking your blood pressure. And now, how do we prevent or improve blood pressure? So, I like to think of this in terms of categorizing avoiding, limiting, and increasing. So, things you'll want to avoid things that may increase your blood pressure. And those things can include smoking. Cigarettes do a lot of damage to our blood vessels. And so, those who smoke cigarettes will have a greater increased chance of having high blood pressure. So, avoid smoking. Avoid illicit and recreational drug use. There are some drugs that are known to cause people to have heart attacks and have high blood pressure. So avoid illicit and recreational drug use. Avoid or limit caffeine. Caffeine can raise blood pressure, which is why we don't want you to have drank a caffeinated drink like coffee within 30 minutes of checking your blood pressure. Avoid or limit alcohol. Alcohol, especially alcohol in excess, can also raise blood pressure. Avoid some over-the-counter medications. So there are some medicines like decongestants, particularly pseudoephedrine or Sudafed, or it's allergy season, and those people who may take one of the medicines, I usually explain it to patients as the medicines with the D on it. So whether that's Allegra D, Claritin D, Zyrtec D. The D just means decongestant, and that decongestant is usually pseudoephedrine or Sudafed. So if you already are a person who may have elevated or high blood pressure, then make sure you are avoiding that type of over-the-counter medication. Cold and cough medicines. Those also contain ingredients that can also raise blood pressure. So discuss that with your doctor if you are a person who have high blood pressure, as to what medications that may be safe for you to take. NSAIDs. So NSAIDs are anti-inflammatory drugs. They are regularly, routinely sold over the counter, and these drugs are things like ibuprofen, which are also under the name of Advil or Motrin, medications like Excedrin, medications like Aleve or naproxen. These medications can raise blood pressure. And what I often see is the patient will come in and you know you have them on the right medications, and then you start talking to them, and yeah, they've been taking some ibuprofen or some Aleve, and now their blood pressure is high. So be sure to talk to your doctor and to watch for medications like that to avoid or not routinely use these NSAID type of medications. And then review with your doctor what prescription medications that you may be taking, because there are some prescription medications that can also contribute to high blood pressure. So if you or recently started on something, or if you have been on something and now your blood pressure is starting to be higher than usual, then you may want to sit down and talk with your doctor and have them take a look over your prescription medications to see if any of those medications can be contributing. Some commonly known ones are birth control pills can increase risk of high blood pressure, steroid medications, and then there are some mental health medications that can also increase blood pressure. In the limiting category, limit things like your salt intake, because we know a high sodium or high salt diet can increase blood pressure. And so we don't want you to not have any salt at all, because our body does need a certain amount of salt and sodium. However, we also don't want you to routinely eat high salt, high sodium foods, because that can raise your blood pressure. And then the increase category, increase things that can help to lower your blood pressure. So those things are exercise. Make sure you're getting at least 30 to 45 minutes of physical activity on most days of the week. So 5 or more days of the week. Increase your intake of fruits and vegetables in your diet, particularly things like dark leafy green vegetables, your spinach, your kale, your collards, berries, blueberries, raspberries, and beets. These particular foods can definitely help to improve blood flow and to lower blood pressure. And then increase the times that you may follow up with your doctor. So if you're noticing that your blood pressure is high, or if you're a patient that's already diagnosed with high blood pressure or hypertension, then you should be routinely following up with your doctor more beyond that annual visit for that general recommendation, but probably every few months, so that your doctor can not only monitor your blood pressure, but also taper your medications appropriately to help to keep your blood pressure at a good range, so that you do not run the risk of developing um, some of those comorbidities or damage from having high blood pressure, the things we talked about, like the heart disease or increased risk of strokes or the chronic kidney disease. So, this is my talk for today. Remember, the essence of health is in you. You can learn more about Essence of Health Wellness Clinic by going to my website at www.essenceofhealthwellnessclinic.com. You can also find out more on Instagram at Essence of Health Wellness Clinic, and take a visit to my YouTube page at Essence of Health Wellness Clinic. You can learn more about high blood pressure and heart disease by visiting the cdc.gov website, as well as heart.org, which is from the American Heart Association. Thank you for joining me today.